Welcome to the Global International Pedagogical Forum, IPM 2020, which I'm representing now. My name is Lilith. Today my guest is Professor Oyewale Tomori, Professor of Virology and Veterinary Science Medicines, former President of the Nigerian Academy of Sciences, former Vice Chancellor of the University of Redeemer. Honorable Professor, we do appreciate that you took your time to participate to the forum and answer our questions.
It is my pleasure, and I'm glad to say a great thank you to Evgeny Baranovsky and the chairman of the organizing committee of IPF 2020, and also to other members who are joining us today. Thank you very much for the invitation. I appreciate it very much.
Thank you, Professor. Although the coronavirus infection has hit countries all over the world, there are still many rumors about it. So the first question is whether COVID-19 really exists.
Thank you very much for that question. You're quite correct. A lot of people still don't believe that it is a problem. It is indeed a problem. It is caused by a virus called SARS-CoV-2, which is known to cause the disease COVID-19, which means Corona Infectious Disease 2019. It started in Wuhan, in China, in the Hubei province, and it has spread throughout the whole world. Over 200 countries now have the disease. According to WHO, about 3 million people have been infected with the disease, and the number of deaths has gone over 200,000, while about 1 million people have recovered from the disease. So it is a real disease, not just a rumor.
Thank you. Thank you so much. The virus exists, and is it just an ordinary flu, or it is something more serious? Because many scientists talk about the synthetic nature of this virus and that it was developed in laboratory. What do you think about that?
Well, there's no evidence yet that it was developed from the laboratory. There are also some rumors going around. But first of all, to the first question, it is similar to flu, but it's not flu. Flu is a disease which is caused by another type of virus, the influenza virus, while this one is also caused by the COVID-19 virus. Both of them start with the respiratory type of infection, while the flu infection comes suddenly. It affects the respiratory tract. This also affects the respiratory tract, but it goes into much more than what you have with the flu. Within 7 days to 10 days, people will recover from the flu. But this one gets a little much longer than the disease and causes more severe infection.
Then how to deal with it?
Flu. They are quite different, two different viruses. First of all, let me say that you have to learn about the virus. We're still learning quite a lot of things about the virus, and therefore, yes, all evidence is showing that we need to know more about the virus before you can deal with it.
Sure. And how to do with the pandemic, because the virus is spreading very widely. So how to do with the pandemic? What measures should be taken?
Exactly. You know, each country has applied different methods. But first and foremost, if the disease has not come into your country, the first thing to do is to prevent it from coming. And how do you do that? A lot of countries have banned travels between those countries where the disease is occurring, because it is a disease that is brought in the human beings. So if you bring the human being into the place who has the disease, you can spread it into your country. But if you limit the number of people coming from where the disease is endemic, then you can limit the number of people who come into your country. But if the disease has settled in your country, then you want to make sure that you don't spread it around, what you call the community spread. By isolating those who have the disease, first you must test them, confirm that they have the disease. And when you know they are positive, you isolate them, keep them away from the people. And those health workers who are dealing with them also protect themselves with gloves, with the face mask, and protective equipment so that they don't carry the disease to themselves or to their families.
Great. You said that in order to combat effectively against the virus, we should know more about it. So at this moment, what do we know about it? I mean, there are some facts already known about COVID-19. We know that, for example, the average incubation period of the virus, 5 days. The maximum period is not known exactly. We know risk
Well,
groups,
yeah, go
men
ahead.
and women over the age of 60. We know that asymptomatic carriers can infect other people. We know that vaccination against coronavirus infection have never been developed. What else we can add to this list?
Thank you very much. Each day we are finding more things about the virus, apart from all the things you have listed, which we can take advantage of in the control. Each day we're discovering, for example, you said no vaccine, no drug. There are some tests going on today that some other antiviral drugs can be useful. But again, there's not enough information gathering to let us know. For example, there have been stories of people who have recovered from disease in Korea who are still over sometimes still testing positive for the virus. So that's what I mean by there's so much more to know about the virus. But with what we know right now, many of which you have listed already, we can take advantage of that. For example, when you said that we know the incubation period, it's anything between 2 days to about 14 days, minimum, average of 5 days. When you know that, you can learn how to keep people in where the disease when it's occurring, and how people can spread it. We know that it is spread through cough and sneezing. And so with all this type of information, we also appreciate that older people who have some underlying disease, have a more severe disease. We also evidence that men are more affected than women. So with all this information, you can plan around it to ensure that people don't get it. Like, for example, you want to keep young people away from the old people, so that because the old are more susceptible to it. And you also want to be sure that this is a virus which can contaminate the environment, which is spread by people coughing according to you. So if you stop, make sure that nobody coughs openly, cover your mouth when you are coughing, wash your hand to prevent any contamination, because this virus can be found on table surfaces where people cough and things of that nature. So all these are steps that you can take to make sure that you prevent further spread of the disease.
Great, thank you. Talking about the measures taken, let's talk about the fact that the China turned out to be faster and more efficient in the fight against the virus. Wuhan is open already, but most of the countries are in very difficult situations. So what's the reason of that? Maybe it can be explained that China uses a disease monitoring system based on example of SARS. And are there any such systems, monitoring systems in other countries, which let the countries, the states, to take immediate measures to combat the virus?
Thank you very much. The good thing about a monitoring system is that you take action when you see the alert. Even though, China eventually overcame the problem of coronavirus, the country still reported over 85,000 deaths, which means maybe they did not act on time, even with the alert. And many other countries have not even learned from the experience of China. Many countries have the same system that China has for monitoring disease epidemic. But it is one thing to have the system. It's another thing to use the system when the alert comes and take appropriate action. Take, for example, this problem started in China in December of last year. Many countries rather assume that it's going to end in China, it's not going to get to them. So they didn't actually prepare, even though they knew that it was raging in China. And many other countries that you find in Europe, and even in Africa, we didn't have a first case in Africa until early February. But we knew that the situation, WHO had started working on it. Everybody knew there was something going on in China, but we didn't prepare for that. Many of the countries, until they had their first case, did not ban transport, people traveling between China or affected countries. My country, for example, we got our first case in February 27. But this problem has been raging in China since December. We didn't take any action until we got our first case. Even after we got our first case, we waited until we got more cases, until about 40 cases, before we now stop people from other countries where the people are. So countries have the same system, but it's when whether they act on time based on the information they get, and that's the problem. And that's why many countries are having the problem they're having now. If a country, for example, at the first time when the first case comes to your country, that was the time you ban transport from those areas. They will have less import into the country before it then begins to spread around the country. Like I mentioned, my country, we didn't stop ban this until over 40 cases had come in. We gave opportunity to it to spread within the country. So countries have the system, but they are not acting as quickly as they should act.
Yeah. Talking about the actions, on January 7, 2020, virologists from Wuhan University warned of a coronavirus pandemic and released into the world a fully defined pathogen genome so that everyone could, as quickly as possible, develop kits for researching the issue around the world. Has anyone dealt with it?
It's obvious that we didn't deal with it, and that's why we have the pandemic all over the place now. I mean, if people are taking note of that information way back when that thing was released, we probably won't have the problem we're having now. So obviously it was a paper publication. It was looked at as that. People did not look at the implication of the disease spreading all over the world until it actually happened. So many times researchers put out the research, but the implication, what follows after, the planners don't look into that. And unfortunately, many of the research publications we have are in journals that the policymakers will not read. And therefore, so it doesn't come to their attention. If we can get science information translated into regular, day-to-day, daily newspaper type of thing, then it may draw attention of people to policy. Or if scientists have this type of information, instead of putting it in those big journals, they are actually reaching something simple and pass it on to the policymakers. Then that would be something that the policymakers are aware. But with the thing in an international journal, there is no way they can be aware of what is going on.
Thank you. So the pandemic is widely spreading. How many people get sick at this moment? What is the scale of pandemic? And I just want also that you talk about also the indicator of infected doctors and nurses as well.
Thank you very much. According to WHO, the figure we have, over 3 million people in the world have been affected by this disease, of which more than 250,000 have died. And the number keeps changing on a daily basis very rapidly. So as I'm talking, I'm sure the number will be getting close to 3 million and 500 or more than that. Although about 1 million people have recovered from disease also. And each country, we're now seeing some countries are in the top level of the disease occurring. They have not reached what you call the curve has not flattened yet in many of these countries. It is still rising, and that's what we're getting. For us in the African region, for example, infection in Africa started a bit late, much later than other parts of the world. But now we are beginning to see the large numbers coming up in different parts of Africa. As of yesterday or more, over 300,000 cases have occurred in Africa, and many more are occurring. In my country, Nigeria, we started with one case in February 27. As of yesterday, our number has gone over 2,000. And the reason it's low is because we're not testing enough. I'm sure the number will have much more than that. So it's a problem, and we are getting worried that even it was in Africa, where the health system is not as strong as it should be. And now, worse than that is the fact that we're getting health workers themselves getting infected. The latest figure we have in my country, over 77 health workers in Nigeria have been infected, maybe not all by COVID, but at least over 40 of health workers, doctors and nurses, have been infected, and many more will be infected. Reason being that they are not provided with the basic protective equipment, the mask, the gloves, and the protective clothing which they need, because they are the first line of defense. They meet the cases first, and they get exposed very easily. So we need to protect those people, because if our doctors are dying, then who is going to take care of us?
Sure. Thank you. And what about the immunity system of people? I mean, if does the immunity develop after the virus, and if so, how long could it protect us? Is it true that people who have had the virus cannot get sick again?
Ordinarily, with virus infections, when you get infected and you recover, you are protected. In fact, that's the basis of why science uses vaccine. You take a weakened virus, make it weak, you give it to somebody so that it doesn't cause the disease, but it allows him to develop immunity. And once he develops immunity for things like yellow fever, it's supposed to last for the rest of your life because there are what you call memory cells within the body, which immediately you get the disease again, immediately you can get infected or you not get the disease because your immunity will build up to counter the agent. Now, as I said, this is a new disease. We don't really have full information for how long the immunity will last. Remember, the first case was in December last year. Even if we had a case in December, and now this is about 5 months, all we can say is that maybe if such people are checked, that the immunity will last for about 6 months or so. So this new, we can't give any concrete information about how long the disease will last because we can only say from the evidence we have, it can last up to about 6 months from the first case up till now. Aside of that, nobody knows. But then there's also the problem that I think there was a report that in South Korea, people who have recovered from disease are still testing positive for the antigen. Why that is happening? Again, when you look at respiratory diseases in particular, take the common cold. A person can get the common cold virus and then 2-3 months later also get the same thing again and get the cold because the area where the virus affects is the respiratory tract, where the cells are not really, they are debrided and they are good. So new cells come up and they can be infected because the dead cells do not confer immunity on the new cells that grow. So with respiratory diseases, yes, you can get that type of thing. But diseases that spread over the body, immunity lasts for a much longer time than we get. So in short, we don't know yet for how long this immunity will last.
Okay, thank you. And what about the summer temperatures? Will summer temperatures help us to stop the flow?
It's, summer temperature alone is not the problem. Even for example, in your office there, even if the temperature is 10 degrees high outside and you're living in an air-conditioned office, it's not the same as being in sunlight. So the environment varies from one place. In Africa, under the shade of a tree, is cooler than the sun directly. If I'm exposed directly to the sun or I'm under a shade, it's different. Therefore, we cannot take the temperature alone. There's also the humidity. If the virus is in a moist place, for example, and is inside a fluid, and the sun is in it, it's quite different from direct sun on a surface. So it's a combination of so many things. It's not just temperature alone. You have to be able to, the environment, the humidity, all play a part. But viruses, by their nature, if you expose the virus directly to the sunlight, I think it's not the temperature, it's more of the ultraviolet light from the sun that actually destroys the virus. So if I'm putting under the shade, the temperature may be the same, but the ultraviolet light may not penetrate where I am. Therefore, the virus will still survive. And that's why people say, whenever you go to a place, wash your hand. Because if I cough on my table, on glass table, or a desktop, the virus can still remain for some time. If I use my hand and touch something there, I can be contaminated if I don't wash my hand. That's why they said, wash your hand often, use soap, because this is a virus, the soap detergent can destroy the virus. So wash your hand as quickly as possible. Keep yourself as clean as possible. Those are the factors.
Okay, thank you. So, and what about the treatment? So far, no effective treatment has been developed. We already know that this is unusual flu, but we do not have a fundamentally new treatment.
Yeah, you're right. Right now, what scientists are trying, they are trying different type of drugs. Some drugs which have been used for certain things before, like chloroquine, for example, like remdesivir, which is a antiviral drug. They are found, and it's just like we don't have anything for it, so let's use what has worked for other diseases before. and see whatever. For example, they are looking at it symptomatically. When you get this, you get fever. And some of the people who are using chloroquine are there to lower the temperature. The ones that are using the antiviral drugs, because the antiviral drugs has helped against a virus which has the same similar property. So they're using it. So, but then nothing is concrete yet. And until we have all the data in from different, take the one of the drugs that they're using, they're saying, oh, okay, it takes a shorter time for you to recover. What about the number of people who are dying? Does it reduce the mortality? All this will be brought in together. So you can't take out one aspect of the disease and say, okay, this drug is working, until you pull all your resources together, go through the normal process of drug testing, drug trials, and then when we have that, because we can say confidently that this drug or that drug will be able to work against the virus.
Mhm. We talked a lot about how can you get the COVID-19 and why is dangerous COVID-19?
It is dangerous because of the ease of spread. I mean, if the mortality they may not be as high as other diseases, but other diseases do not spread as fast as COVID-19. Therefore, even if if it spread faster than other diseases and is killing, maybe the mortality is lower, but because it's spreading faster and affecting more people, then it may end up being a more severe disease. I mean, look at now, we already have information that it has killed over 200,000 people. It has affected 3 million people. Take Ebola, for example. With all the noise that was made by Ebola, how many people got infected? We had only about 20, maybe 30,000 people infected and 11,000 dead. Already, this virus has surpassed that one for almost like 3 million compared to 30,000, and 220,000 people dying compared to 11,000. Yet, that's why the virus is quite more dangerous. Although not as severe as Ebola, but it spread faster and it affects more people than Ebola would. And therefore, on the long run, it becomes a much more serious disease than, say, Ebola that we're all afraid of.
Okay. So what measures should be taken not to suffer from coronavirus? I'm sorry, Professor, the connection is not good. Did you hear my question? Professor? I'm sorry, the connection is not good. Professor, can you hear me? Hello? We will wait until the connection will be restored.
Hello, can you hear me?
Yes, now I can hear you. I
I'm sorry.
apologize for the connection.
No, I think it was from my side. No problem.
I will repeat the last question because I'm not sure
Yes.
that you heard it.
Yes, please go ahead.
So, okay. So what measures should be taken not to suffer from coronavirus?
Thank you very much. I think the most important thing is not to get infected. And not getting infected means don't expose yourself to somebody who has the disease. And how do you do that? If there's a suspicion that somebody has the disease, you keep your distance away from the person, up to at least a meter. The reason being that the source of infection will come from, because a respiratory problem, and the man is coughing and sneezing. You want to keep your distance away from where the coughs and the droplets can touch you, either enter through your mouth, through your nose, or through the eyes. So you want to keep a distance of at least a meter or more from somebody who is sick. You want to put on a face mask so as to protect you from the whatever is spitting out, falling on your mouth or your eyes or your nose, or you breathing it in. You want to make sure that if the person has passed through the place and has coughed onto a table and contaminated your table or your glass, you don't go there and get yourself infected. And by doing so, anytime you touch a table or that, you make sure you wash your hand. Don't keep putting your hand in your mouth, on your nose, or whatever, because it has been contaminated from some other source. So, and what if somebody has the infection? It's advised that he should self-isolate himself, keep himself away from other people. In addition to that, if you are sick, then go straight to the doctor and get into an isolation ward. With those steps, you can prevent yourself from getting infected.
So it means that self-isolation is effective?
Oh, yes, it is. Self-isolation is effective because not only for you, but also for those who are close to you, that you don't spread it to them, the disease to them.
Okay. And what about quarantine? Because some states imposes quarantine. Is this a necessary measure to fight against COVID-19?
Quarantine alone on its own cannot be done. I mean, what they call lockdown or whatever in many countries. There are two sides to lockdown. The lockdown effectively prevents people gathering together in large numbers so that you don't mix and spread it in a large group. Quarantine means you reduce trafficking through transportation, like all these fast trains, public transportation, and those kind of things. But in addition to that, there's a role that the individual has to play in the lockdown. Like I always say, COVID is not going to kill the government. COVID is going to affect the individual and kill the individual. Therefore, what the individual does is even more important than the lockdown. By that I mean, if you maintain the good hygiene, if you put on your gloves, if you put on your mask, if you put on and keep yourself away from those people, then you are protecting yourself. And if you don't have it, then you can be a source of infection to another person. So quarantine or lockdown has its advantages, particularly in many of the countries like we have, where we don't have a good health system. You don't want many people getting sick to overload the health system. I mean, let me also take example now. Because of this COVID in many African countries, all other things that our health system used to do, we're abandoning them. Everybody is focusing on COVID-19. We are forgetting immunization. We are forgetting the routine treatment of people for common diseases like malaria, like diarrhea, and all those things, because the hospitals are fully engaged in dealing only with COVID-19. And that's a major problem. Now, other people will be dying from diseases they could have recovered from. So it is important that, for us in many of our African countries, you put a system that will reduce mass congregation of people together and mass movement. But at the same time, must provide the people the palliatives that they require, because a lot of people are daily workers in many African countries would get their food on the work they do per day. So if you lock them up, it means they may not have enough money to feed themselves. So government must put in place what you call steps to ensure that those people will have something to eat during the period of the quarantine or lockdown.
Okay. Thank you so much. And about the vaccine, when will the vaccine appear?
It's a difficult thing to say. Normally, a vaccine would take anything from 2 to 6 years. But we've seen with the Ebola that it was fast-tracked. With the Ebola, because of the urgency, the process was fast-tracked. And we got Ebola by a year and a half. It was possible to get the Ebola vaccine and then full use, but although it wasn't licensed until another 2 years after that one. With this one, things are even much faster. It's expected maybe about 6 months. Already, some vaccines are on trial. People have started the first trial, the first clinical trial, the second clinical trial will soon come up. So we're looking maybe between September and the end of this year, we should have a vaccine available. But then whether the licensing of it will take a little more time. So we look forward to about September up to December for a vaccine to be available after being tested in clinical trials.
And the last question, can coronavirus destroy humanity?
Well, we pray not. We pray it doesn't. But if we don't take time, it will not really destroy humanity, but it will damage humanity. It will affect it in such a way that our life will be totally different. I mean, you already see that economically, it's affecting the economy of most countries. A country like Nigeria depends on oil, where 90% of our resources come from oil. Now the price of oil has gone down to much less than what it should be. So our economy is in tatters. We're actually getting worried about what is going to happen after COVID. We have to rebuild our economy again. And it's not just for Nigeria. Many other countries are having the same problem. And therefore, it may not destroy humanity, but it will cripple our economy to the point that we may have to start all over again.
Okay. Honorable Professor, thank you so much for your valuable and very interesting opinion. Stay safe and healthy. Thank you so much.
Thank you. You too. Thank you. My pleasure. Thank you very much. And you too, stay safe. We need you to do more work for the world.
Thank you.
Thank you. Bye-bye now.